Hello everyone, in this video we will talk about the anatomy of the thyroid gland. Now the thyroid gland is a shield shaped gland and it is situated at the lower part of the front and sides of the neck. So if we have the neck, it is situated in the lower part of the front and sides of the neck. If we look at the basic structure of the thyroid gland, it has two lobes, which is the right lobe and the left lobe. These two lobes are connected by a structure called the isthmus, which lies in between these two, and there might be sometimes one additional lobe, which is the third lobe or the pyramidal lobe. So what do we have? We have the right lobe and the left lobe, the isthmus and the pyramidal lobe. Now this pyramidal lobe, when it is present, it is connected to the hyoid bone. So this is the hyoid bone, this is the pyramidal lobe. When it is present, it is connected to the hyoid bone by a structure called levator glandulae thyroidae, which is a fibrous structure. So let's repeat the anatomy again. The right lobe, the left lobe, isthmus, pyramidal lobe, connected to the hyoid bone by the levator glandulae thyroidae. If we look at the vertebral extent of the thyroid gland, it lies against the C5 to C7 vertebrae and may also go up to T1 level. Okay, and then it is related to the upper part of the trachea. If we look at the extent of the individual lobes, the lobe starts from the middle of the thyroid cartilage. So the upper part of the lobe will be associated with the middle of the thyroid cartilage to 4th to 5th tracheal ring at the bottom. So the upper part will be associated with the thyroid cartilage and the lower part will be associated with the 4th to 5th tracheal ring. This is the extent of the lobe. And if we talk about the isthmus, the extent is from the 2nd to the 4th tracheal rings. So this is the extent against the C5 to C7 and T1 vertebrae. Upper part of trachea. Lobe lies from the middle of the thyroid cartilage to 4th or 5th tracheal ring, and isthmus lies between the 2nd and 4th tracheal ring. If we look at the dimensions of the gland, each of the lobes measure 5 centimeters by 2.5 centimeters by 2.5 centimeters. That is the dimension of the lobe, 5 centimeters in length, 2.5 in width and 2.5 in breadth, in thickness. And the isthmus measures 1.2 by 1.2 centimeters. The average weight of the thyroid gland is 25 grams, but it is more in females usually. Now the thyroid gland has capsules. It could have either true capsule or false capsule. The true capsule is formed from the gland stroma itself. So if we look at this picture, if this is the gland stroma itself will form this true capsule. Whereas the false capsule is a condensation from the pretracheal layer of deep cervical fascia. So the deep cervical fascia has the pretracheal layer. It condenses to form the false capsule. And if we look at this gland, again this is the gland stroma, this is the true capsule and this is the false capsule. Underneath the true capsule we have a venous plexus. So whenever we do a thyroidectomy, the true capsule is left behind so as to preserve this venous plexus. So these are the capsules. The true capsule formed from the gland stroma itself and the false capsule coming from the pretracheal layer of deep cervical fascia. Now one thing about the false capsule is that it is thick on the posterior aspect. So on the posterior aspect of the thyroid gland, the false capsule will be thick, and this thickening is called suspensory ligament of Berry. And it is this suspensory ligament of Berry that connects the thyroid gland to the cricoid cartilage. So the suspensory ligament of Berry is what connects the gland to the cricoid cartilage. Now if we look at the parts and relations of the thyroid gland, we have an apex which is related to the superior thyroid artery and the external laryngeal nerve. So the artery, the superior thyroid artery will enter the thyroid gland at the apex. This is what the apex is related to. And the base is related to the inferior thyroid artery and the recurrent laryngeal nerve. So we have inferior thyroid artery and recurrent laryngeal nerve related to the base, and the superior thyroid artery and external laryngeal nerve related to the apex. Then we have a medial surface And this medial surface will be related to our two tubes, the trachea and esophagus, which are the two major tubes in the midline. Then we have two muscles, inferior constrictor and cricothyroid, and then two nerves, external laryngeal nerve and recurrent laryngeal nerve. These are the structures related to the medial surface. The lateral surface of the thyroid gland is associated with muscles. So it has the sternohyoid, omohyoid, sternothyroid and sternocleidomastoid. The muscles in the neck are related to the lateral surface. Finally, the posterior surface is related to the carotid sheath. The thyroid gland has two borders, an anterior border and a posterior border. The anterior border is associated with the anterior branch of superior thyroid artery, and the posterior branch is related with the inferior thyroid artery. Anastomosis between the superior and the inferior thyroid artery occurs on the posterior border, or it is related to the posterior border. And then we also have the parathyroid gland, which is associated with the posterior border. Finally, we have the isthmus. The isthmus has an anterior surface which is related to all your muscles of the front of the neck, the sternothyroid, sternohyoid, and then we have a vein called the anterior jugular vein, which is also associated in the front or in the anterior surface of the isthmus. In the posterior surface, we have the second to fourth tracheal rings. That was, if you remember, that was the extent of the isthmus, and that is what it is related to posteriorly, the second and the fourth tracheal rings. Then we have an upper border which is related with the branches of the superior thyroid artery, and we have an inferior border or a lower border which is associated with the inferior thyroid veins. Now let us look at the blood supply of the thyroid gland. So in the arterial supply, the upper part of the gland is supplied by the superior thyroid artery. This superior thyroid artery is a branch of the external carotid artery, and this superior thyroid artery will divide into anterior and posterior branches, and it will supply the gland at the upper part. Next, we have the inferior thyroid artery supplying the lower part of the gland. Now, this inferior thyroid artery is a branch of the thyrocervical trunk, which in turn is a branch from the subclavian artery. So, the subclavian artery will give the thyrocervical trunk, and this thyrocervical trunk will give the inferior thyroid artery. This inferior thyroid artery divides into multiple branches before entering the thyroid gland. A third artery called the thyroidea ima artery, arising from the brachiocephalic trunk, may also be present in 3% individuals. Now these arteries are very closely related with nerves as well. So the superior thyroid artery is related to the external laryngeal nerve, and the inferior thyroid artery is related to the recurrent laryngeal nerve. Both of these nerves are branches from the vagus nerve. What we have to remember here is that when doing a thyroidectomy, when we ligate these arteries, the arteries have to be ligated as close to the gland as possible so that the nerves around them, the external and the recurrent laryngeal nerve, do not get injured. For the venous drainage, we have a superior thyroid vein which drains the upper part of the thyroid gland, and this vein drains into the internal jugular vein. Then we have a middle thyroid vein which also drains into the IJV. Finally, we have the inferior thyroid veins which drain into the brachiocephalic vein. And these brachiocephalic veins will in turn drain in the superior vena cava. In the lymphatic drainage, the thyroid gland first drains into the prelaryngeal, pretracheal and paratracheal lymph nodes. And from these lymph nodes, the lymph drains into the upper deep cervical or the lower deep cervical lymph nodes. The sympathetic nerve supply is from the superior, middle and inferior cervical ganglion of the sympathetic trunk. So the sympathetic trunk will give the gland its sympathetic nerve supply, and the parasympathetic nerve supply will be from the superior and the recurrent laryngeal nerve.